Okay, this is a recorded lecture on neuromotor control, and we're going to discuss how the neurological system is organized for movement of the limbs versus movement of specifically the speech muscles. So I want to discriminate between the upper motor neuron system and the lower motor neuron system. So when it comes to controlling parts of our body, messages are sent from the cortex of the brain down through neural pathways through the brainstem, and for speech, this information is passed through the corticonuclear tract, and for the limbs, this information is passed through the cortical spinal tracts, and these tracts are part of what we call the pyramidal tracts, and the pyramidal tracts are the nerve pathways that are for skilled movement. And that's what I want to emphasize in this lecture. We do have extra pyramidal tracts also, and this is mostly for supportive motor functions such as posture and tone. And if you don't have any posture or tone in your muscles, it's hard to then build skilled muscle movements on top of that. All of the upper motor neuron pathways are in the neuraxis, which just means that they're in the brain. And they are either organized bilaterally or contralaterally, and we'll get into what that means. If it's bilateral, it means for one particular muscle, that muscle receives information from the cortex, from both sides of the cortex, both right and left. If it's contralaterally controlled muscle, that means a muscle on the right receives information from the left side of the brain, and vice versa. And then we have the lower motor neuron system, and this is also referred to as the final common pathway. And this is the final common pathway are either cranial nerves or spinal nerves. So cranial nerves control muscles of the head and neck, and spinal nerves control muscles of the limbs. Okay? And these are called second-order neurons because the first-order neurons are the upper motor neurons that go from the cortex down to the either cranial nerve or spinal nerve nuclei. And then there's a synapse, and it's a new nerve that is the lower motor neuron, whether it's a cranial nerve or a spinal nerve. Now, the lower motor neuron system is always organized ipsilaterally. That means that the nuclei on the right sends information through the nerve pathway on the right to control a muscle on the right, and vice versa. So here's just a depiction just to help you get it, your head wrapped around it. And all I want you to do is just realize that this is kind of what it kind of looks like in your brain, where you have from all these points in the cortex of your brain, millions and millions of neurons passing down through those points to then converge in this area, which is what's called the internal capsule, and then down in through to the brainstem. Here's the brainstem, and going down further, and here is the spinal column. Now what happens, so this is all upper motor neurons, okay? So they travel through the brain, down through the mid portions of the brain, and then they decussate or cross over to the other side around the level of the medulla in the brainstem, okay? So the upper motor neurons cross over to the other side before they synapse either on the cranial nerve nuclei for speech or the spinal nerve nuclei for controlment of the limbs. Okay, so in regards to motor neuron control of the limbs, remember this is controlled through the cortical spinal tract. That's just the name that we have given for all these nerves that are going through the brain that are going to control the limbs. It's always contralaterally controlled, so it's simple for the limbs. It's just what we always think of. The right side of the body is controlled by the left side of the brain, and vice versa. The left side of the body is controlled by the right side of the brain. Okay? That means that the upper motor neurons from the right side of the brain connects to the lower motor neurons, the spinal nerves, in the left side of the spinal column, after they have crossed over at the level of the brainstem. And then from the spinal column, the nerves just go out on the same side to then tell your limbs what to do. Okay? And the lower motor neuron pathways from the nuclei to the limbs is always ipsilateral, same side. Now, it's not quite as simple with the corticonuclear tract, which is the upper motor neuron system for the speech muscles. Okay? In this case, rather than it being that rule that the right side is controlled by the left side of the body and the left side of the left muscles are controlled by the right side of the brain, I think I said that wrong, that the right side is controlled by the left side of the brain. left side controlled by the right side of the brain. Rather than it being that rule that we all know, actually with the speech muscles, most of the nerves that control the muscles in our head and neck are actually bilaterally controlled. So that means that the right upper motor neurons connect to both right and left cranial nerves and vice versa. So make sure you don't get that confused. That means that if you have one cranial nerve nuclei, okay, on the right side, that cranial nerve nuclei is receiving information, or in essence is connected to both right and left sides of the cortex, okay, and vice versa. So that means that muscles are controlled by both sides of the brain. And so both sides of the brain are involved in sending the signals to any muscle that's bilaterally controlled. This provides a defense, obviously, so that if you have an upper motor neuron lesion to a bilaterally innervated muscle, that one side, that unilateral lesion, doesn't have that much of an effect because that muscle can still receive information from the other side of the brain. Okay, so we're going to just focus a little bit on specifically the nerves for speech. Okay, so this slide shows all the nerves that are involved in our speech, and the information on the left side of the slide as you look at it are all of the nerves that are bilaterally controlled, and that's 5, the trigeminal nerve, 7, which is the facial nerve, and notice that it's only for the upper face. The glossopharyngeal nerve, which is 9, the vagus nerve, which is 10, and the hypoglossal nerve, which is 12, which also has an exception. So the only 2 nerves that are receiving contralateral innervation are portions of the facial nerve, the portions that control the lower half of the face, and specifically the genioglossus muscle, which is controlled through the hypoglossal nerve. Okay, so for that, only that one muscle, which is your biggest muscle in your tongue, that one muscle is contralaterally controlled. That means the right side of your tongue is controlled by the left side of your brain. The left side of your tongue is controlled by the right side of your brain. And again, the organization beyond that point, beyond the upper motor neuron pathway, so the lower motor neuron organization is always ipsilateral. Okay, so here's a depiction just to give you a drawing, and then we're going to watch some video clips to just kind of to show you the differences in the symptoms that you see with patients. So don't let this confuse you. This is just showing the patient's right side of their face and the left side of their face. It's not to say that this diagram of the brain is a sagittal section of the brain. It's not. It's a coronal section. So it would be like this is the front of the body. This would be the patient's left side of the body, and this would be the patient's right side of the body. Now, this is at the level of the brainstem, and this is, whoops, I'm sorry. Let me fix that and go backwards. I gotta be careful. I can get a little finger happy there. Okay, so if this is the nuclei for cranial nerve 7, the top half of the nuclei controls the upper half of the face, and the lower half, which is the red here, controls the lower half of the face. Okay, so as you can see, the upper half, which is the upper half of the face, is bilaterally controlled in that it's receiving signals from the left side of the brain and from the right side of the brain. Okay, but the lower half is only receiving information from the right side of the brain. So here we have the left side of the person's face, lower face, and it's only controlled by the right side of the brain. So it's showing you in this picture here that if the lesion was right here, the person's upper half of their face would not be affected because it can still receive this information from the black. Okay, so this is still connected. Okay, but if the lesion is right here, this lower half doesn't have any connections coming from the cortex, so that would result in the patient having a lower facial paralysis. Okay, so before I go on to that, I'm going to escape out of this, and I'm going to go to a website called Neurologic. And it's a really great website, and you should go to it to just learn more about a lot of the concepts that we're teaching in this class. The first video I'm going to show you, there is no sound, but you're going to see that the gentleman has weakness on one whole half of their face. Okay, so I'll just open that up and we'll let it start playing. Okay, so what actually minimizing doesn't do me any good. The screen size stays the same. So they're going to zoom in here in a second, and you can see that this person's right half of their face is completely paralyzed. Okay? That means he can't close his right eye, he can't raise his right eyebrow. I think they zoom out a little bit, and he can't do anything with his lips on that side. So this is an example of a lower motor neuron lesion, meaning a lesion to cranial nerve 7, because it's cranial nerve 7 that controls that side of the face. Now, if it was a lesion, and actually I don't want to show you this one because it's not quite as clear. I'm also going to click on this other image. And this next video, there is sound, and I can't turn it off. But what I want you to pay attention to is not what is being said in the video, but pay attention to what you see in the patient's face. Because the video is actually about sensory stuff, and we're talking about motor. But I just want you to observe what you see in the patient's face.
So you feel better on this side. This side would be normal.
Exactly. Around my eye, I feel very well on the right side.
And how? But this is different here.
It's different.
Here,
It's different.
and here.
My skin feels like sunburnt.
Okay.
Okay, so again, don't be paying attention to what she's talking about, because she's talking about sensory stuff and we're talking about motor stuff. But you should have easily been able to notice that her whole right side of her face is not moving. Okay, so this again